Here at Iowa Methodist, pharmacy residents, faculty, and students are an integral part of our interdisciplinary care teams on the internal medicine teaching services. And that's whether they're on the wards or in the intensive care unit. And as director of the internal medicine residency program, I wouldn't want to have it any other way. Simply put, I think that these care teams are best run when the pharmacy team is embedded directly with the team on rounds, as well as at the bedside when patient care decisions are being made. Because of this interdisciplinary approach, our patients definitely receive superior care, and I think that all of our learners, whether they be pharmacy students and residents or internal medicine residents or medical students, they all receive a more well-rounded education. And on top of all that, the folks in the pharmacy department are a great bunch. They are hardworking, endlessly collegial, and just plain fun to be around.
Hi, my name is Haley Nelner, and I'm one of the PGY1 pharmacy residents here at Iowa Methodist Medical Center. I'm originally from Waconia, Minnesota, about 40 minutes west of the Twin Cities, and I did my pharmacy education at the University of Minnesota College of Pharmacy. I originally met Laura, our residency program director at Minnesota Society of Health System Pharmacists Residency Showcase last September. And talking with her a little bit about the program, I was immediately impressed by one, all of the opportunities, the wide variety of different elective rotations offered here, and also two, the close proximity to Drake University College of Pharmacy and how much the residents get the opportunity to teach at Drake, an elective course in the spring, and also the students, the pharmacy students that are on rotation that we get to precept. So a lot of experience there, which was important to me because I was a TA during pharmacy school. And now being here as a resident, I'm very impressed with the dedication and passion that the preceptors have for teaching residents and helping us grow professionally. And also, I really enjoy the amount that pharmacy is really appreciated here by the providers and the great relationships that have been established.
I rank Unity Point Health Des Moines because it was the right place. I also think it's the right size. My two co-residents provide company without competing for opportunities. And then finally, it has the right opportunities. It has a very fast-growing kidney transplant program. It has all the opportunities you'd expect from a level 1 trauma center. And it has extensive opportunities in both adult and pediatric medicine.
As part of my duties, I am one of the members of the antimicrobial stewardship team. As part of this team, I often have the opportunity to work with pharmacy residents that rotate through our stewardship service. And as part of those rounds, we usually try to have them be both clinical and didactic. I've also had the opportunity to mentor a few of our pharmacy residents in different projects related to stewardship, and always with the aim of optimizing antibiotic use and diagnostic tools. One of the things that I really like about our team here in Des Moines is that you can truly feel that there is a multidisciplinary support, not only in terms of collaboration between the infectious diseases physicians and the pharmacists, but also collaboration and support from nursing staff, microbiology staff, and IT. So it really is a place where people have a great sense of duty and a great pride in their job, and so are always here to help. And so this really allows for our pharmacy residents to have to make the most of their time here at Unity Point and focus on learning and improving on the practice of pharmacy.
It's an expanding patient volume, and the medical center here is always busy. We're a level 1 trauma center with a very high patient acuity. We see critical illness in the pediatric world with Blank Children's, and in the adult world here in the Methodist Emergency Department. The pharmacists work right alongside the nurses and the ER physicians on a regular basis and really help us in a pit crew style approach to managing these critical illness patients. We'll have them start drips and initiate different medication protocols like TPA for stroke right alongside the physicians placing the orders and the nurses getting IVs. So it's really a big group effort where everyone is contributing from their expertise. I personally routinely will curbside our pharmacist in the ED about the right medication selection or combination, reviewing culture results and trying to figure out the right antibiotic for a patient, and sometimes even sitting down and having academic conversations about the literature supporting different therapies over others. And so it really gives you an academic feel for training in the context of a bread and butter community emergency department.
One thing that really drew me to Iowa Methodist is the huge number of rotations and opportunities for residents. There are so many ways to customize and tailor your residency to your particular interests. There's also a lot of unique opportunities at Methodist that you may not find at every residency site, like transplant pharmacy, pediatrics, and palliative care. We're one of only 2 level 1 trauma centers in Iowa, which means that as residents, we get to be involved with a lot of unique and interesting cases. Residents also get to lead a class for pharmacy students at Drake University in the spring, in addition to helping precept students as they rotate through the hospital during the year. There's truly something for every interest here at Iowa Methodist.